I moved here 2.5 years ago, and I ended up having a heart problem that I really didn't know I had. I thought I had asthma, I couldn't breathe, and maybe had bronchitis. Turned out I ended up with a quadruple bypass and an aortic valve replacement. Yeah, I had congestive heart failure. Although you could tell that I don't know what I'm talking about when it comes to that. But that was the thing. They took me off the medication to help with my circulation, which has been an ongoing issue since about 2017. So, and I was fine. I had taken vitamins, my foot was all healed, and then I scratched myself on the side of my foot and then on the other side. I didn't cut it, I scratched it. It was one of those scratches we go, ooh, it burns, but it doesn't really bleed. I lost a toe because of it, and a bone. And it became infected. It was excruciatingly painful. I mean, really painful. I was hospitalized about 4 times before they did the surgery. And so they did the surgery. It was still bad. I went to like a rehab. And then I came here. Then I met the people here. I knew, I shouldn't say that. I actually came here before all of that happened to me. But I didn't qualify for the hyperbaric oxygen at that point. My foot, the wound wasn't deep enough. I didn't have any infection, nothing like that. Well, that changed within 2 months. And I'll tell you something. When you have something wrong, it changes rapidly. It's amazing how quickly it happened. I mean, I had a normal-looking foot, and then I didn't. I had all like dry gangrene, black toes, and I mean, there wasn't a person around, aside from my husband, my cheerleader, who thought that I was going to heal those toes. And Jamie thought that possibilities were endless. Hyperbaric oxygen works miracles, and I personally think that that's exactly what it does. It works miracles. I was in here. I loved being here. I felt so good when you go into this chamber. At first, it might seem like a little scary, but instead, it's the opposite. I felt very peaceful and calm, and I just felt like I knew this oxygen was healing me.
You go in, is it loud? What's it like?
No, it's quiet, it's calm. At first, you immediately feel the pressure as the pressure is changing, and then, your ears are popping, so you pop them, you pop your nose a little, pop your ears to make sure, that you can clear them, so to speak, with this high oxygen pressure. And then once you do that, it reaches where it's supposed to be at 2 or whatever the number is that Jamie puts it on. That's remarkable. You just lay there, you're just very calm. It's fine. You could actually fall asleep, which I'm sure I have a couple times.
All right, Miss Deborah, we're coming out.
My foot's almost healed over here, and I have 0 pain. And believe me, I had pain. So I spoke to my doctor, my surgeon, and I said, if I had pain, if this was not healing, it's healing. So I'm not that quick to jump into surgery because I'm a diabetic. I have peripheral artery disease. I have a stent in my thigh, and the day that they did the amputation over there, the following day I had 2 more angioplasties in my calf. So, I have like cement leg, so I'm not jumping into that. There's no way that I'm going to just voluntarily just go that route. The hyperbaric oxygen, I truly believe, besides the fact that it cleared up all of that stuff on the toes, all of it, that's gone. I believe that it has put this osteo that I have into remission. Now, I don't mean to imply that everybody who has that would be in some remissive state or inactive state, that type of thing. I don't know. But I really believe, for me, that is the case. 100%. I would have pain, and I don't.